Welcome, everyone, to this week's Oregon Minute. This episode, we are interviewing Casey Jesberger, who has been the division chief of Oregon's Emergency Medical Services since July 1st, 2020. And we're talking to him about the COVID pandemic and how he settled into his position. So, how's it going, Casey?
Good. Thanks for having me.
It's really good to have you. So, you said, as I just stated, that you've been in your position for about 7 months. And how have you settled into that position so far?
Still settling in every day, but all in all, I'd had been here for a little over a year as a paid on-premise member. So I had a great opportunity to meet everybody, meet the staff here, and work with the staff before I started. So that transition has been nothing short of wonderful. Things have been going very well here. We do have a great staff here, and really every day and every week that I'm able to come to work and do my thing, we are moving onward and upward. So the transition from January 1 to now has been really nothing short of progressive. So I'm really happy with that.
Well, I'm happy to hear that, but it makes me curious. Like, what does your day to day entail? Because you started as division chief during a pandemic, so you probably don't know what normal looks like. The pandemic is normal. So just tell us what does your day look like?
So I'll probably just go a little bit back in time. I have been doing fire and EMS since summer of 2001. So I've been able to do it as a career, as a volunteer, paid on-premise member, really the whole gamut for almost the last 20 years now. And so I do have a pretty good idea of what normal is. Prior to coming here, I was the operations manager with Sunbury EMS, managing the day-to-day operations there with staffing and call review and purchasing and the like to all that stuff. So the transition here hasn't been much different in the sense that you're still managing personnel, you're still managing schedules, you're still managing call reviews, policy procedure reviews, training, and the like. So that transition has been fine. The hardest part with the pandemic is the amount of limiting people into our station, trying to space our crews out with social distancing, making sure things are clean, where we would generally like to have a lot of people come together and do a lot of hands-on training. Now we're doing more virtual training and more, or had been more social distance training, which doesn't always lend a great hand to all the tangible things where we put things in our hands and work with things and put things together and do all the practical stuff. And most of us are more hands-on learners than we are book learners. So that throws a wrench into things. As we've come almost a year now in this, we have a real good handle on how we keep things clean, how we monitor each other, people getting vaccinated. So we're kind of getting back to normal, so to speak, as whatever normal is right now.
Yeah, normal has a entirely new connotation now, as we're pretty much a year into the pandemic. And that makes me wonder, have you received your COVID vaccine, Casey?
Yeah, one of the first couple of days that the vaccines were offered, I went and got mine, and got my second one 3 weeks after that. And I would say, for whatever reasons people have to either get them or not get them, almost our entire staff has received both rounds of vaccinations by now. There's only a couple outliers, and that's by all means their choice. We haven't forced it on anybody, but for the size of staff that we have, we're actually pretty fortunate that we got almost everyone. So.
Just to relieve any members of the public or viewers that might be nervous, did you experience any significant side effects or anything from receiving the vaccine?
Some people had. I was one of many here that didn't have any side effects, and I'm very fortunate for that. I also had COVID go through my house. My son had COVID, and he just felt kind of blah for a couple of days and got over it, minus losing his sense of taste and smell, which was odd for him. Otherwise, we had the exposure to ourselves, and we had the opportunity to have the vaccinations. My wife as well, who also does emergency services, and did not have a reaction. So we were very fortunate for
that. And I appreciated how you brought up your experience or your time with Sun Prairie EMS, because that was going to be one of my next questions is, Like where do you come from, and what originally brought you or attracted you to Oregon in this position?
Yeah, so my first day out of high school back in 2001, I started riding ambulance with the city of Sun Prairie. That's where I grew up and was there for a couple of years. My first fire department that I was on, I think in 2002, was at the town of Blooming Grove with Chief Linsmeyer. So he was my first fire chief. Um, with all the time that passed, I ended up dispatching for the city of Sun Prairie and for the 911 center for 4 years, the Dane County 911 center. After that, I spent 11 years with the city of Janesville Fire Department as a career firefighter. A couple other places along the way too, gaining experience. I don't want to bore anybody with my long saga of places I've been at and all the experience that I gathered. But back in 2017, my family moved from Edgerton up to Stoughton. I was able to get on Oregon here, reunite with Chief Linsmeyer. This position became available, and I was very fortunate to get the management and leadership opportunity with the city of Sun Prairie, transitioning from a career firefighter at Gainesville, firefighter paramedic. Um, but it was only EMS. I'm a firefighter at heart. So it was nice to have the opportunity where I could come to this job, really focus on doing the EMS aspect and training everybody and help transition into a paramedic level service here sometime in the not so distant future, and really still be able to do a hands-on fire training and participation, and really try to take this department that has a lot of young members and a lot of young individuals that are eager to learn and help mold their career so they can get hired at career jobs.
So, what attributes and traits do you think make you a good division chief?
If you would have asked me that 10 years ago, I would have no idea. I think as I have 20 years in the service and I've grown and matured and be able to see where I was at, where I started my career, and the attitudes and the presentation that I presented myself to my coworkers and the job itself, and see how I've transitioned and transformed from a very young, naive individual to a more seasoned individual with a lot of different experiences of call types and call demographics and community types and different diversities to that nature, and being a father and being a husband and having my ups and my downs. I like to think that all plays a role into my diversity that I can bring in with the conversations that I have with my coworkers, that I can put myself in their shoes in a lot of different good positions and bad positions in different life events, and try to share my experiences to make these folks have someone that they can lean on, and someone that understands someone that's been in their shoes before. So I think that's where you get a lot more buy-in. I'm not a guy that just wants to lead from my desk, but I want to be able to have an open door and work side by side with these individuals here.
What do you think one of the most significant challenges your position carries? Knowing that, I mean, working in public as a public safety official, I mean, I'm sure there's periods you have to debrief maybe after an intense situation or things like that, especially during the pandemic. But yeah, what has been one of the biggest hurdles, maybe?
I think it is trying to keep people excited to come to work. This is a job that is different as it is. It's the same, a lot of repetition, doing a lot of muscle memory. Um, you, you're not usually seeing anybody on a good day. You're always seeing them on a bad day, and a lot of the same routine over and over. And that's, I mean, we get good by doing the same routine over and over, but sometimes people feel stuck, or um, they go on some bad calls and have a hard time bouncing back from that, or the ups and downs in people's personal lives that they bring into work that carries over in what's already a stressful job. Um, so a lot of us go through ups and downs in our careers, and to try to make sure that people don't get in those downs, or if they are in those downs, we try to get them back up and get them back to be more enthusiastic and happy to come to work, and just really trying to keep people's emotions up, their spirits up, their energy up.
I would imagine that this pandemic and the work that EMS officials, police officers, frontline healthcare workers have done have inspired the next generation of people who want to work in that field. As an EMS chief, what advice do you have for that next generation?
That's a good question. I think it's even more than that. I think that we've seen through the media over the last year or so, or maybe a couple of years even, where police, fire, and EMS and medical workers have been supported. They also haven't been supported. So it's really trying to find that balance and find the truths are out there and what the jobs actually entail and what anybody in the public services do. But it really comes down to all these are jobs of passion and heart and people that want to take care of other individuals, want to take care of their community, people that want to give back, people that want excitement. Because a lot of times this job is full of excitement. So it's really people trying to find their passion and going with it. I don't want to be cliche about this, but some people say it's a calling, and I don't know if I go that far in saying it. But I grew up and I was a kid that was always chasing fire trucks, so something that I always wanted to do. And so if people are watching the news or they're seeing somebody go by or they feel that they have some type of a civic duty or they have an inkling to get out and help people, I say go for it. Get the education, go to fire school, go to EMS school, go get your nursing license, get educated, and figure out what your passion is and go for it.
What safeguards do you think are in place? As you said, the job can be a very thrilling one. It's one that requires empathy and the ability to, insert yourself in the shoes of other people. It requires on your end good leadership and just the ability to form those interpersonal relationships. But there are, and you've talked about some of the challenges as well, but what safeguards are there in place? It's a high stress environment. So what safeguards are in place maybe for mental health and things like that among staff?
Yeah, that's a real good question. And mental health in general in emergency services has kind of been on the back burner for a real long time. And we're always told to bury our emotions and not show your emotions, and that we see bad things or bad things happen. It's just part of the job that you need to deal with it. As we move along, we realize that things hit everybody differently, and we don't need to just bury it. We need to deal with it, and we should deal with it and seek the help that we need, or rely on those that we can talk to. So we can do it as low as just a one-on-one with crews talking back and forth after calls. If we go on like a significant car crash or a fire, after we get all cleaned up, we'll do like what we call a hot wash or debrief. Back to the fire engine, back to the ambulance, and just talk through the call and have different roles, or talk about like our different roles and tasks that we did, and make sure everybody is doing well, not doing well. I do a lot of run reviews. Our medical direction team does run reviews of like our EMS calls. So we'll look at the patient care reports, get a good understanding of what's going on, how our providers are treating the patients, what calls are going on. Then I'll meet with crews one-on-one, get feedback on how they did, how the patient's doing, try to close the loop, because a lot of times not be able to close the loop. And the whole patient care dynamic also plays a role in where our minds are, what we're thinking about, and just layering on and on. Then when we have significant incidents, we do critical incident stress debriefings. Our Dane County partners and our fire partners have a group of firefighters and EMTs that go to different fire stations and help debrief and counsel. And then internally, we have our own employee assistance programs where we can refer people to counselors, different doctors and associates. We really try to build a robust program and many avenues for our providers to seek help if they need it.
Those sound really effective safeguards, especially as we continue to endure this really, people use the word unprecedented a lot, and this unprecedented pandemic. But I think that's all the questions I have, Casey, unless you have anything else you wanted to add to this conversation.
No, I don't. If there's anything else, by all means, let me know. Give me a call back or whatever, and we can throw some more down for you.
All right. Sounds good, Casey. Well,
All right.
thank you so much for joining in with us today, and thank you to our viewers for joining in as well. As always, episodes are at 7 p.m. every Thursday, and feel free to tune in for all the good content we have for you. Thank you, everybody.